The Daily 2 is brought to you by Charlotte Eye, Ear, Nose, and Throat Associates. Welcome to the Daily 2. I'm Laura Polka. We're on location today at CEENTA's Matthews location, talking all things sinuses with Dr. Jonathan Moss. Thanks for being here. So tell our viewers where our sinuses are, what they do, and what happens when they're not working properly.
Yeah, our sinuses are located in our face, really out to the side of the nose. And they're just air-filled cavities, and most of the time we don't even know they're there, and that's the way we prefer it. But when something goes wrong, people will feel it, and that's when issues arise.
And how can a sinus infection be diagnosed?
Most of the time it's diagnosed just by clinical symptoms, which is a longer duration and more severe symptoms of a cold. And that typically might require nasal sprays or antibiotics and steroids to resolve. But sometimes symptoms persist or treatment isn't effective enough. And at those times, a lot of people end up seeing an ear, nose, and throat doctor.
Right.
We have more, better techniques, we'll say, that we can diagnose sinus infections with.
So talk about all the ways that you can treat sinus infections here at the Matthews location.
Yeah. So for one, as far as the diagnosis, we can look in the nose with cameras and see further back in the nose. We can see where the openings to sinuses are. And another definitive way to diagnose it is to do a CT scan, which is basically an x-ray of the face that will show inside of the sinuses. The sinuses are surrounded by a bone, so that's really the way we have to look inside of them. And then once it's diagnosed, we can then determine the best ways to treat it. It might be oral medications, it might be topical medications, or for some patients who just don't respond to that, then surgery might be needed. There are ways we can do that in the office, or it might have to be done asleep under a general anesthesia.
All right, Dr. Moss, thanks for all the great information today. We appreciate it. If you'd like to learn more, go to CEENTA.com. For the Daily 2, I'm Laura Polka.